Hey guys, this is Sarah Faison, and I'm going to be talking about meningitis in the adult patient. Meningitis is a rare infection that affects the delicate membranes, called the meninges, of the brain and the spinal cord. There are several types of this disease. There are viral, bacterial, fungal, and parasitic. Basically what happens is normal pathogens which cause strep throat, pneumonia, things like that enter the bloodstream and set up infection in the brain, which causes irritation. So what puts your patients at risk for developing meningitis? Well, first of all, as we know, anybody who skips vaccinations. There are vaccinations against meningitis, against pneumonia, a Hib vaccination when you're a child. If you skip those things, you're putting yourself at higher risk. Age. Most cases of viral meningitis occur in children under the age of 5, and bacterial meningitis is common in those under 20. But as with a lot of things, you're very young and you're very old are at higher risk. Living in a community setting puts people at higher risk simply because of the way meningitis is spread. It is spread through secretions, bodily fluids. So when you live in a community where people are sneezing and touching things and sharing, that puts you at higher risk, which is why we see it in college campuses and in the dormitories. Pregnancy puts you at higher risk, and then a compromised immune system. If you don't have antibodies to fight things, you're always going to be at higher risk. So when a patient presents to the clinic, 3 questions you may want to ask to kind of get things going are this. First of all, have you been running a fever, and for how long? And the reason this question is important is because in meningitis, a fever comes on very suddenly and it's a very high fever. So knowing how long the patient has had this fever and how high the fever has gotten can kind of give us a direction to go. The next question is, have you been around anybody who's been diagnosed with meningitis? And obviously this is a great question because if they have been around that person, the chances are that they too might have it since it is highly contagious. So we would definitely want to know that. And then the third question could be, have you received your meningitis vaccinations? Again, we said those who did not receive vaccinations are at higher risk. So if they did not have their vaccination, now they have this high fever, they have this stiff neck and some of these symptoms, we're definitely going to start leaning in that direction. So there are 3 components that are vital in diagnosing meningitis in the physical exam. First of all, you can look for the Kernig sign. What this entails is lying a patient flat and raising up a leg one at a time. If the patient is unable to keep their leg straight and it bends at the knee because they're in pain, that is an indication of a positive Kernig sign and meningeal irritation. That's usually a good sign that this may be meningitis. The second sign that we're looking for is the Brudzinski sign. And in that one, you lay the patient flat, and as you raise the patient's neck, if that pain causes them to bend their knees up, again, that is a positive sign, a Brudzinski sign, and maybe an indication of meningitis. Then you also want to look at their neck, and you're looking for nuchal rigidity. Have them try to touch their chin to their chest, and if they're unable to do that, complaining about that stiff neck and a really high fever, those are going to be indicative that this might be a meningeal infection. So the way that you treat this is going to be very aggressively, especially in the case of an acute bacterial meningitis. You're going to go with intravenous antibiotics and corticosteroids. First line defense is generally ampicillin with a 3rd generation cephalosporin until you can determine the exact cause, and then you're going to treat whatever bacteria it is that you've identified. While swift treatment helps with this, you're still going to lose about 14% of the patients in the bacterial meningitis. Now, with the viral meningitis, there's nothing that can cure it. It's just symptomatic care. Bed rest, plenty of fluids, over-the-counter pain medications. You may use steroids again just to reduce swelling in the brain, anticonvulsants if seizures are a part of it. Priority teaching for these patients who have meningitis would be focused a lot on making sure they don't spread it. Wash your hands. Practice good hygiene. No sharing drinks, food, straws, utensils. That's going to be out. Staying healthy for themselves. They need to get plenty of rest, drink plenty of fluids, get some exercise, have a good healthy diet filled with fresh fruits and vegetables. Then they need to cover their mouth, sneezing, coughing, making sure that they're not giving that infection to family and friends. And then the most important thing is to get vaccinated. Making sure that you're up to date on those vaccinations are going to prevent you from getting into this meningeal infection in the first place. If you do those things, hopefully your patient will have a great outcome.